I won't be trouble no more. Oh, soon I won't be trouble no more. Ooh, we are, soon I won't be trouble no more. I'm going home. Yes, I am. I'm going home. No more weeping, no more wailing. I'm going home. The way you shall see some trouble, we shall be rest. I'm going home to live with my Lord.
Lord, we come today not only because sickness has pervaded the land, but an unnecessary death has taken place. Lord, we're so grateful that those who had a little bit was able to get some insurance. But we're deeply saddened that those who had it, Lord, died because it was taken away. And so we come today in hopes that you will open up some ears and touch some hearts. But, oh God, we know that it don't happen unless pressure comes. And so we're here today to stand on behalf of the least of these.
We stand before you today to bury those lives that have been lost and will be lost due to the failure of this state to expand Medicaid. We stand before you today to bury the jobs lost due to the failure of this state to expand Medicaid. We stand before you today to bury those rural hospitals that will have to close their doors because of this state's failure to expand Medicaid. I stand before you today as someone who is directly affected by this state's failure to expand Medicaid. See, I work at a local church that does not offer health benefits, and I'm a full-time student at Tennessee State University. But by the time I graduate, it is very possible that my student loans will be dwarfed by hospital bills. Every day that passes is another day closer I am to a hospital visit I cannot afford.
We want a TennCare that does its job without being sued.
Enough! Close the gap!
We want a TennCare to support accessible health coverage for those who need it the most.
Enough! Close the gap!
Stop turning away federal funds for Medicaid expansion today, which at this moment is $764 million.
Enough! Close the gap!
Stop cutting funding for and leaving children locked out of care. This is yesterday's Tennessean. Children are paying the price for the governor's decision.
Enough! Close the gap!
And those policies are leading to hospitals being closed. It's the right thing to do.
Enough! Close the gap!
54% of those people who are locked out of TennCare because of the governor's decision are working people. They work in restaurants, they work in hospitals, they work in schools and jobs that are not in the professional groups. They work behind cleaning your office. They're the people that come in after you go home if you work in an office. And they need to be insured. Governor, you have the right to bring solutions, not divisions on the issue. We'll stand behind you if you do the right thing, but we're not going to go away if you keep doing the wrong thing. Thank you.
Today, as we talk about the gap, the Affordable Health Care Act was designed to make sure that everyone could have access to affordable health care. Most people get health care through health insurance. For lower income people, the affordable health care was supposed to expand TennCare using federal dollars so that all Tennesseans, even those who cannot afford insurance, would have access to affordable health care. But Governor Haslam, Speaker of the House and Speaker of the Senate, decided they would turn down federal dollars for TennCare expansion. It is immoral to have people dying, and you decide because of your political affiliation that you want to turn down billions of dollars to insure our people.
First figure that I was given just a moment ago said that as of today in Tennessee, and this may have already been said, 861 Tennesseans are dead, have died because we did not have Medicaid expansion. Every life matters. Go along with that. It's not right, and we can do something about it. It's not right, and we can do something about it.
As President Sweet-Love and the other speakers have communicated, this is an issue of healthcare justice. Governor Haslam's refusal to accept the funds provided by the Affordable Health Care Act has proven to be a matter of life and death for many Tennesseans who do not have health care coverage. It is unconscionable to think that our governor would refuse the federal dollars that our residents have already paid into a system in one of the poorest states in the nation. His decision to turn down these funds is deeply involved in partisan politics. We will not stand by as residents of this state and allow our human right to have access to affordable health care be made into a political football. The adverse impact of Governor Haslam's decision can be felt across the state. We have 54 rural hospitals that have been financially destabilized because of our governor's decision. 4 rural hospitals have already had to close their doors to hard-working rural Tennesseans who critically need access to affordable health care. We stand today at the Tennessee State Legislature to funeralize the denial of Medicaid expansion. We have the casket, and we will go on to bury this denial of health care justice in Tennessee. But we will not grieve long. In fact, we rejoice at the resurrection of life that comes forth when death-dealing public policy that supports the denial of human life is no longer with us. We will continue to press our legislators and our governors to do that which is right for the people of Tennessee. This is only the beginning of a protracted, nonviolent struggle for human rights in Tennessee. We also insist that the healthcare advocates have a seat at the table in shaping of Tennessee's healthcare plan. If we are refused seats at this table, it would be a rejection of democracy.
Joy, joy today is mine. I told Satan, get thee behind. Joy today, come on. Freedom is mine, freedom is anybody got it. Freedom is mine, come on. Freedom today is mine, come on. I told Satan, get thee behind.